You already heard this morning about this wonderful program SFA, and I'll tell you about it as well, but from a little bit different perspective. I'll tell you what the program actually did in Ukraine, how lives were saved and which lives were saved, how light was taken out of the darkness, and what a great impact occurred thanks to all these people and thanks to this, you would think, simple program. How basically stress was turned into strength. We all know that war is a horrible thing. Such a cliche, right? But it's not. When the war began, the whole Ukraine and the whole civilized world became very stressed, to say the least. But we also were very optimistic and hopeful because we thought that once we are fighting, once we are resilient, this is going to be over very soon. Okay, a few more days, few more weeks, few more months, right? That's it. It cannot go for so long. After all, we are in the middle of Europe in the 21st century. The world is civilized. People travel the world. People speak different languages. People drink caramelized latte and lavender rough, whatever it means, right? But still, there is this barbaric war right in the middle. Seriously, literally, territorially, in the middle of Europe. People killing each other. And this is important to know because this what helps you understand what a terrible distress right now Ukrainians are going through, regardless of whether these Ukrainians are. This is just a photo of how Ukrainians spend their nights in bomb shelters, in metro. This is Kyiv. The situation is deteriorating in Kyiv as opposed to many other cities as well, especially the closer the city to the front line, the worse the situation is. And the worse the situation is, the worse mental health of Ukrainians is. So we are basically right now talking about a tremendous, deep crisis around mental health in Ukraine. How did the war change Ukraine in terms of mental health? Well, how would any war change the country, right? The answer is clear. There is nothing good about that. But the numbers are telling us that 74% of Ukrainians report experiencing psychological problems due to the war, yet only 13 have sought professional help. That, of course, is a sad number, but the number 13 can be explained easily. Before the war, we did have a stigma that, mental health is not really a problem. Come on, pull yourself together, work. After all, there is even a joke that in Eastern Europe, we don't have depression. So that goes to this story. But also, when the war is happening, the priorities change. Everything becomes about survival, about helping others, about making it to another day. And people think, well, mental health, that's something else. Well, think about this tomorrow. 80% of Ukrainians experience persistent stress and anxiety, leading to a significant mental health burden. I would also add that it leads to a terrible burnout, professional, emotional, mental burnout, and ultimately to trauma and stress, of course. And then we're talking about population-wide trauma. As the world knows, millions of Ukrainians had to leave the country or were displaced internally, having lost their lives we all had before the war, homes, loved people, social connections, jobs, everything. And chronic stress and anxiety. This became part of the daily life of every single Ukrainian and their families. Now, why did we start working with healthcare providers? Before the war, we used to work with healthcare provider on tobacco control, on smoking cessation, because smoking is a #1 risk factor, a preventable risk factor for non-communicable disease. And speaking of mental health, smoking also has a great burden on mental health. When the war began, the situation deteriorated, and we figured that we have to consider mental health and smoking, but not of a general population, but we should start with healthcare providers. People who are on the front lines, figuratively and literally speaking, who have to help others, and very often, because of this, who forget about themselves. And again, that leads to a total burnout, stress, anxiety, depression, and so many worse mental health conditions. It turned out that 1 of 5 healthcare providers in Ukraine reported negative effects from prolonged war-related stress. Nothing surprising, I assume, right? Why is that? Well, because doctors have a completely different job to do. Their job changed. Not just the war changed, but their job literally changed. They started operating in trenches. They started being shelled, bombed every single day and night, regardless of whether you're close to the front line or whether you are in the downtown of Kyiv. They witnessed friends, neighbors, someone killed or gravely injured, and yet they have to continue with their job going on. Here is what it means to be a Ukrainian healthcare provider right now. This is a photo taken in Kyiv, in the capital of Ukraine, very far from the front lines, but that's the shelling. It's a missile strike last summer on one of the biggest hospitals, children's hospitals, Ahmadit, which is in the center of Kyiv. That's the hospital that takes kids with very complex conditions. Some of them are in a very close to death conditions, and doctors save them. So this hospital was killed. This hospital was hit, and these are the doctors saving the situation. This is also the photo of this same hospital. This is what it means to be a healthcare provider in Ukraine these days. That's just a regular polyclinics where a doctor coming in the morning finds their room, the facility, all shelled and bombed with glasses on the floor. After this, talking to the healthcare providers with whom we used to work, who were our colleagues and friends, we decided to do a survey. And that was the representative national survey on the burnout, to see how bad was the burnout among Ukrainian healthcare providers. I should mention that at that point, not many healthcare providers realized the difference between the burnout and stress. Some of them thought that the burnout is almost like depression because you are stuck, right? It's an ability to move. You cannot move, you cannot think, you are paralyzed. And that's what the survey discovered to us. So it turned out, that was January 2024. 78% of healthcare providers became more anxious only during the past year. 60% were always finding themselves in tense environment. So that means that wherever they were, on the front line or at home, let's say in Kyiv or in the West, they still felt unease. They still felt stressed and burnt out. 58% felt chronic fatigue. 66% felt that always or often they could not perform the same duties as they managed before the war. I also should mention that this can be explained by the fact that there are many internally displaced people who had to move from one part of the country, from the east of Ukraine, to the center and to the west, which means that healthcare providers, especially family doctors, had to take over this burden and help all those new people. So that's, speaking of the burden and burnout, that's also contributed. Here are some of the answers, quotations provided by Ukrainian healthcare providers in that survey. So we tell ourselves that we are strong, but even strength has limits. Sometimes I feel nothing left to give. And that was one of the most common response of the doctors. And you can see self-blame here, right? As if a doctor is blaming themselves that they are not good enough for their job as they used to be, that they cannot help people the way they used to help before the war. And they think that they have to work on themselves, even though the war is going on and everything is just falling to pieces. In the frontline communities, we experience a natural fear, anxiety, tension, and all of this leads to a total burnout, says another healthcare provider. We don't know when the war ends. We are constantly being told not to relax because it will last 1 more year or 2 or 5. So here you are, not seeing any future. And this is one of the worst things. As I mentioned at the beginning, everyone at first was thinking that it will take, 1 month, 2 months, okay, a year, okay, a year. But more and more, and that's what the doctors are talking about, that, you can pull yourself together thinking I have another year to go, another year and a half to go. But right now, there is no vision of the future. You cannot plan anything, you cannot dream, you don't even know whether you'll be alive tomorrow. So that adds up to burnout and stress. The burnout challenge, 43% of healthcare providers were not aware of the strategy to cope with daily stress. That's why we desperately needed the SFA program. 72% did not receive any relief or psychological assistance as part of their professional duties over that past year because there were no resources. Because it's a burnout, it's a catch-22. And 80% did not look for psychological help even privately during that last year. And again, why did they do that? Because the priorities are completely different. One doctor said that almost everyone on my team is burned out now. I'm being honest, almost everything, and I'm close to that. Now I feel that I'm close to this. People go into blind defense, like we have to go through all of this, that's all. At one of our trainings in Kyiv, at the end of the training, we gave to every participant as a present a book written by Viktor Frankl, the famous psychiatrist who went through Holocaust, who went through several concentration camps and became a famous psychiatrist. And this book, who hasn't read it, highly recommend it. It's called A Man Searching for the Right Meaning. There he talks about how to make it in hell, how to survive, how to find that joy and life even in the darkest time. And that's why we handed out those books to our Ukrainian healthcare providers and military chaplains, and they loved it. And I personally reread this book 3 times during the war. It is a support. So to change the situation, on May 14 last year, we pulled together a great summit in Ukraine on resilience. Over 100 healthcare providers came from all over Ukraine, including from frontlines, to Kyiv. Northwell team came. We had lots of government representatives and international communities, and that summit served as a platform to support healthcare providers and also led to the launch of the complex stress first aid program. These are the photos from that first wonderful summit that became the platform. Ideally, we wanted to launch stress first aid program for all over Ukraine, because why not? But also, let's have reality check. We figured that that was not feasible or realistic at the time. So we had to come up with a pilot project in one territory. And we had to choose the territory that needed us the most that very time. That's how we chose Bucha. Bucha, for many of you known as the saddest witness of the worst human atrocities committed by the Russian army. And Bucha is only 30 minutes by car from the downtown of Kyiv. 500,000 people live in that area. Over 1,700 civilians during the month of occupation of Bucha were killed, including 12 kids. 9,000 war crimes were committed in that very little town. And the burden on healthcare providers was awful. Mayor and Rebecca and some of the colleagues who went to Ukraine, they met those healthcare providers from Bucha who went through the occupation. In fact, some of their family members are still in captivity. They went through occupation, but they did not leave Bucha. Because why? Because people needed them. That was still their answers. And when you ask them, are you sorry? And they can say, I'm sorry that I lost my son to the captivity, but I'm not sorry, I do not have regrets that I did not leave Bucha and stayed because all those wounded civilians needed me at that moment. That's the photo of Bucha on the first day of liberation, the 1st April 2022. Now it looks much better, doesn't it? This is our team and the first day of our stress first aid training for Ukrainian healthcare workers, done in Bucha. See how happy they all are? And I have to mention this, that when this training happens, even before the training happens, it's already a ray of sunshine for all the healthcare providers, because they know that these 2 days will be the days of stuff for them, the day of knowledge, celebration, wonderful people, warmth and light, and the burnout will disappear, even temporary, and that will be a great recharge for all of them. So it's a celebration when this happens. You can see how happy those faces are. That day we had over 50 healthcare providers. Originally we counted for 35, but 50 showed up, and we could not say no to anyone, and we fit them all in, and that was a blast. So, and they completed the training on trainers on stress first aid. That was earlier in this year, in January. So participants included family doctors, psychologists from Kyiv Regional Mental Health Hospital, and also from the city of Kyiv. Family doctors are very important in Ukraine due to many reasons, but number one is that it's a family doctor that is the first point of contact for every person who comes to a medical institution. It's a family doctor who listens, who consults, and who figures out what's wrong and what the next protocol, next steps should be. Also, it's important for family doctors, as you can see here, during COVID pandemic, which was right before the war, and now that time seems very nice to all of us. But back then, family doctors shared their cell phone numbers with lots of patients to help them, so that patients could reach out to them when there was quarantine and people were not allowed to move around, right? So people kept the phone numbers, and healthcare providers are still being reached out day and night by all those people. And guess what? Because of the war, you become softer. Lots of people, on the one hand, you become stronger, more cynical often, but you also become softer and kinder to your people. So right now, as our healthcare providers are telling us, if they have a call in the middle of the night from one of their patients, they always pick up the phone. They give consultations. They say, the situation is serious or not. If serious, they call an ambulance. So this is how it happens. In other words, they're very, very much involved personally and emotionally in every case. Whether it's good or bad, professionally, probably bad. But from a human point of view, given it's a war, I'm sure it's gold. That's our training, and you can see the mayor of Bucha, Nataliia Toropova. That's him. And this is John, the chief psychiatrist of Moscow. So Nataliia Toropova, the mayor of Bucha, was delighted to hear that we are launching SFA in Bucha, in the whole district. And he came, and he didn't just show up officially, but he did participate in the program for basically the whole day. Given how busy he is, that tells a lot. He would never do anything he's not interested in. So that was, and you can see the situation even on this photo. The situation is very at ease. People are very relaxed. People are very engaged. That's exactly what we were hoping for. And that tells you that there is a blackout caused by another strike. But we still carried on in the darkness. And you can see two healthcare providers with a flashlight. And that's a wonderful Northwell team. This is a great phrase. After the training, my colleagues and I began meeting regularly to discuss our stress levels. During the war, none of us is truly in the green zone. But now, whenever we notice signs of slipping into the orange zone, we make it to a point to talk openly and at length. offering each other full support. This is a woman on the photo. She's speaking to Mayor, and that's what she's actually telling Mayor. She's a very famous doctor in Ukraine. She's Dr. Larisa Matyshenko. She's actually the head of the Bucha Ministry of Health. She lost her husband. Her husband was a famous hero of Ukraine, a pilot who was killed over Snake Island. Her house was burned down, and her car was burned down, and her daughter's house was burned down. The bottom line is the family suffered very much. And yet here she is, carrying on with her job, smiling. By the way, I have to tell you the story. When she came to our training and met us, after that she came to me and she said, I have a confession to make. This is the first day today since the 26th of June 2022 that I did not cry, because every single day I cried before. So isn't that an accomplishment? Isn't that an impact? That's the best metrics, right? You would think. After this, the more people found out about this SFA training in Ukraine, the more requests we started to hear. And the next request came from the Armed Forces of Ukraine, but not just Armed Forces of Ukraine, but from the military chaplains of the Armed Forces of Ukraine. And that made sense, because in a way, they are healthcare providers, only spiritual. And military chaplains were from all confessions, from all denominations. They all came together and they literally said, please help us, we need help, because we are burnt out, we don't know how to help other people, all we see is death, funerals, tears, we cannot carry on, and we have to give them hope. So that's the training for military chaplains took place in Kyiv in March. And you can see those wonderful people of light, smiling, shining, and it's hard to say that 90% of them literally just came from the front lines. The door opened and they entered in their backpacks, in dirty boots, and look, I mean, they are there. So over 50 military chaplains participated in the session. And what was good, since that was a TOT for healthcare providers, you can see on this photo some of the healthcare providers, including Larisa Matyshenko, who already was helping us to do the training for military chaplains. So the system worked in two different ways, just like we planned. On the front lines, military chaplains serve side by side with soldiers, supporting their morale, assisting mobilized troops in adaptation, and providing guidance to anyone in the army struggling with stress, and that's everybody. They also play a critical role in accompanying families of the fallen, offering compassion and strength in the darkest moment. And this is the hardest part, as they tell us. One military chaplain from Bucha, Anatoly, he told me that sometimes it gets so bad for him to deal with families, and he found his own remedy, speaking of SFA. He goes to a bakery and smells and feels the smell of the baking bread. And he says that he can sit there for hours just smelling the bread being made. And then he says, I feel completely recharged, as if I feel life, literally. And he says, I'm able to go back. But all those chaplains were incredibly grateful, and they brought this knowledge to the front lines, to their units and brigades. We received answers to our own questions, how to restore ourselves when every day we give all our strength and emotions to others. Now we will pass these tools to our fellow chaplains. These are the words of one of the best opinion leaders in Ukraine, Orthodox priest Andriy Kalita, who is from Kherson, but who is on the front lines right now. And most of those chaplains, as I said, are very well known in Ukraine, public leaders. Now, on the side of health initiatives, there is a special section dedicated specifically to stress first aid program. And I think that was a very wise decision to do, because now all Ukrainian healthcare providers, military chaplains, social workers, everyone has access in Ukrainian to those helpful materials, and there is an English version as well. What changes did we see after the SFA in Ukraine? We did notice increased stress awareness, and that's what Richard was talking about yesterday. Doctors became able to recognize stress in themselves and colleagues, and as we know, this is the beginning. Early intervention cultures, teams started addressing stress proactively, and people started to speak to each other openly about that. Stronger peer support, yes, we did witness that. Improved coping skills. Participants developed practical strategies to manage acute stress in high pressure environments, and they're doing it quite well. I know that some healthcare providers organize even a book club right now in Bucha, and are trying to read books together, which distracts them at least for an hour a week. Reduce burnout, that's perfect, and emotional exhaustion. Providers report feeling more resilient and better able to sustain their work. They also mention that what helps their resilience is the fact that they know that somewhere there are we who support them and who care and help them. And that's the preparation of focus group. I want to pass it to Mayor, because Mayor was always with us. So that's like, I feel with everything I say, I should be speaking to Mayor, because right from the first start, Mayor was with all the healthcare providers and the chaplains. Thank you.
Thank you, Natasha.